Good evening, fellow members and brethren of Faith Assembly of God Church and the viewing public at large. My name is Dr. Teani Small, currently a medical practitioner at the Linden Hospital Complex. Today I'm tasked with informing you of the new coronavirus that is currently causing a pandemic in the world at large. So, what we need to know about the coronavirus. First off, we all know that it's something new, something that's never been presented to the world before. So, scientists at large are learning new things about this virus every day. So, we're urging and imploring that whatever it is that we tell you and urge and ask of you to do, that you cooperate with us and just follow along. So, in terms of the signs and symptoms of this virus, we all know that it presents with a dry, persistent cough. It also presents with high fever, chest pains, shortness of breath. It may also, in some instances, present with headaches, sore throat, pains about the body, loss of appetite, loss of taste. So it's needless to say that persons who present with these symptoms may be positive for coronavirus, because as we all know, the flu also presents with similar symptoms. So not because you may have these symptoms mean that you may be tested positive for the coronavirus. In addition to the symptoms, if you would have traveled to an area that is present with cases of the coronavirus, or came into contact with person who may have been tested positive for the coronavirus, or if you travel to a country which have cases of coronavirus, then we can say, well, possibly you have these symptoms. And if it is that you present with these symptoms, we're asking you to contact the hotline. And we know that now the Ministry of Health also have an app that you can go to and put in your symptoms, and they will assess and evaluate and tell you what to do. So if you have these symptoms, we're asking that you call the hotline. The hospital here in Linden also have one. The number is 444-3007. So we're asking you to call this hotline and don't necessarily show up to the hospital, because if you show up to the hospital, it's possible that you may, if you have it, you may contaminate other persons. So call the hotline first and they will instruct you on what to do next. Now, how you can prevent this disease from spreading? First and foremost, we're encouraging persons with social distancing. Stay at home if you don't have to go on the road. If it's not absolutely necessary and that the job does not require it, or there's not something that you desperately need from on the road, stay at home. The distance between two persons should be no less than 3 feet or 1 meter. We're even asking to increase it as much as 2 meters or 6 feet, so as to prevent the transmission of the droplets. Also, we're encouraging persons to wash your hands with soap and water as much as possible, as this helps to dissolve and terminate the virus. If you don't have soap and water, you can use hand sanitizers with 70% alcohol or more. That is just as effective. We're also asking for you to use your face mask when in public. Ensure that your mouth and your nose are tightly sealed so that nothing can escape or get in. When you get home from work, take off your shoes at the door. When you get into your house, walk straight to your washroom, take off your clothes, put it there, go take a bath before you come into contact with other persons in the household. After you would have done this, you just take your Lysol spray or your wipes and you sanitize, make sure that everything is clean before you start handling things in the home or creating contact with other persons. If you go and you shop and you pick up from a supermarket, we're advising that you spray down these items after, so as to prevent contamination, because remember, we don't know. In terms of using gloves, because a lot of persons think if you use gloves that you're safer, it's not so, because if you don't know how to use the gloves, you are possibly spreading disease more than actually helping. As you may have your gloves, you put it on, you touch one surface, you don't know who would have touched that surface before you go, you touch somewhere else, or you touch something else, you pick up something, So with the same glove you have on hold, you come into contact with different surfaces, and if you're not sanitizing or cleaning or even changing the gloves as often as possible, you may likely be spreading the virus more than helping to control it. So instead of using gloves, we're just asking you to walk with your hand sanitizer or your alcohol rub, and after contact with things, you just wipe your hands, wipe your keys, wipe your phone, wipe your cars, wherever surface you may have touched. Wipe it with alcohol instead of using the gloves. So these are some little health tips on how we can help to prevent the spread of this disease and keep ourselves safe. And I'm urging and I'm imploring and even begging you, if there's no need for you to go on the road, just stay home. It's just for a while. Eventually all this will pass over, and then you get to go out into your normal public lives and continue as you used to. So just stay home. Help us to help you. Prevention is always better than cure. Thank you for listening. God bless.